Today on Acupuncture Masterclass, I'm going to be reviewing the location of one of my favorite points, kidney 6. Let's take a look. Now, I've received a number of requests to do this particular point from my YouTube subscribers, so thanks for sending those requests in, and today I'm finally getting around to it. Kidney 6 is known as a point to nourish yin. If you're going to remember one thing about it, that's probably it. Since the kidney supports other organs, it tends to nourish the yin of other organs such as heart, lung, and liver. So the yin of the kidney nourishes the yin of some of the other organs in TCM. A very helpful action, often neglected when it comes to kidney 6, is its relationship with the throat. So for issues such as sore, dry throat, or nausea, or even globus hystericus, commonly known as that lump in the throat. If any of those things are happening, kidney 6 should be considered. When I first introduced the location of kidney 6 to my students, they're a little flabbergasted as to how a needle can actually fit into this very small space. There only seems to be bone in this location. However, with some good anatomical palpation skills, some good anatomical landmarking, and some interesting needling technique, you'll be able to needle kidney 6 like a pro. Let's take a look at the close-up. Okay, here's our close-up of the medial side of the ankle. I'm obviously in a side-lying position just to illustrate this a little bit easier for the camera. Most patients would be face up or face down, but the main things that I want to get across with kidney 6, the location of kidney 6, we have some anatomical landmarks to consider first. The main one being the tip of the medial malleolus. So this black dot here is representing the very tip of the medial malleolus. Now remember, that doesn't mean the lowest part of the medial malleolus or the highest part of the medial malleolus. This is the very tip, the highest point of the medial malleolus itself. Very important concept to understand. That is an important anatomical landmark there. I have some little strips here to represent some other anatomy that we need to be paying attention to as well. So for kidney 6, traditionally located 1 cun below the tip of the medial malleolus. Sounds simple enough, but a lot of people have trouble with locating this particular point because there is so much dense anatomy in this area. It is just simply hard to feel for. So once you've identified the tip of the medial malleolus, if you go directly inferior, meaning you go directly towards the bottom of the foot, you will fall into a nice space. Just 1 cun below the medial malleolus. Now, the anatomy that you want to be palpating for, in some people, you'll actually be able to see this posterior tibialis tendon running just behind the malleolus itself. That's usually the first most obvious visual anatomical or anatomy that you're going to see for kidney 6. Now you want to be inferior to that, or sometimes you might say even posterior, but you can see we are inferior to that tendon that runs just alongside the inferior side of the malleolus. Posterior to that, there is a lot of anatomy in here. Like I said, lots of ligaments, other tendons to be concerned about, but there's kind of this broad band of tissue that runs posteriorly towards the ankle. And this kind of creates this Y shape right in here. And kidney 6 is located just in between those two bands of tissue right there. So really, when you're looking for kidney 6, you should visually be able to see this posterior tibialis tendon running underneath the malleolus itself. And as you palpate in the area, you might feel this posterior border of tissue stopping your finger from going any farther anteriorly or posteriorly. But you have to palpate for kidney 6. Very important to get comfortable with the anatomy in this particular area. Needling is done perpendicularly right in this nice space, and you'd believe it, it's quite a bit of depth that you can get for kidney 6 when you're needling this, despite how dense the anatomy is in this location. One quick tip when it comes to needling kidney 6, a lot of people's feet change angles when they're on the table, so you have to accommodate that while you're finding kidney 6. So you might have to go slightly more posteriorly when they are face down and their foot is more flat. You might have to go slightly more anteriorly when in a neutral position. The common mistake, people go anterior to this tendon. Just watch for that common mistake. Do not be anterior to that tendon. You can actually feel it as you flex and extend the toes here. You want to be posterior and inferior to that tibialis tendon. Kidney 6. Well, I hope you all learned something about kidney 6 today. Thanks again for watching, and I hope to see you all again soon.